Good morning or good afternoon, depending on your time zone. Welcome and thanks for joining us for today's HIS Talk webinar, Modern Imaging Technology for the Enterprise, Mercy's approach that improved imaging cost, speed, capacity, and care quality. It's brought to you by Mercy Technology Services. I'm Lori from HIS Talk and I'll be moderating. Our speaker today is Jim Best. Jim is an executive health IT consultant at Mercy Technology Services. And with that, I'll turn it over to you, Jim.
Lori, thank you very much. It's a real honor and privilege to be speaking with all of you today. Hope everyone's having a great day. Hope you're a little cooler than where I am here in the Dallas area, but and hopefully you're inside someplace listening to this. So, like Lori said, my name is Jim Best, and I have been in healthcare a little over 40 years, actually closer to 45 years. I have several decades of experience in mostly in imaging and executive roles. I have one of those evolving careers that's been very rewarding. Several years in radiology. I had a number of executive appointments in healthcare operations, and then spent the last 10 years of my full-time employment working on large-scale projects as part of the IT division for Mercy Health System. And for the last few years, I've been sort of in a semi-retired capacity doing executive consulting for imaging for Mercy. So these are topics I'm very passionate about, and I'm very, very happy to be speaking with you today. Some of the things that we want to accomplish today in terms of objectives will be to design a holistic and future-centered governance approach to imaging. So we'll be talking a lot about governance. To analyze your total costs so that you can evaluate vendor pricing with confidence, preparing for infrastructure such as security and other potential challenges, and to identify ways to tackle those challenges, and to be able to define your current state and look at some of the universal challenges and what's possible out there. I really intend to keep this somewhat high level, more from a strategic perspective. So those of you who are expecting a lot of in the weeds technology, we'll touch on some things, but we'll be happy to reserve those discussions maybe for offline or another time. So here you should be looking at the map of Mercy Health System. We're located in the Midwest, largely along the I-44 corridor, and provide health services in 4 states, Oklahoma, Missouri, Arkansas, and Kansas. And you can see some of our numbers there. We are a large organization. We've been centered and headquartered out of St. Louis really for a number of years. Mercy was started by the Sisters of Mercy back in the early 1800s. And when they came over from Ireland, they ended up in the St. Louis area, and the health system has been there ever since. And so we have over 40 hospitals, and as you can see, well over 40,000 co-workers. And another map I'd like to show you next is a little bit more from a larger perspective, but this is the extension of our mission beyond Mercy and some of the other clients that we represent in terms of hosting healthcare services. And we literally now have a presence from coast to coast, as you can see. And this is largely because of our Epic services that I'll be talking a little bit more about here in a little while. But we now have a presence in over 70 hospitals and over 70,000 users. And so it's a large footprint, and we're very, very happy to now be talking about how imaging can be a part of that extended footprint. So for Mercy, and if you know anybody that works for Mercy, we're all about our mission. We're very, very passionate about it. It's a very, very strong statement, not only about how we treat people, how we treat each other, but how we think about healthcare holistically. That is more than just services, but it's very much mission driven, which causes us to think about how we do things. And for us, that's all about innovation and technology, and we're very, very happy that we've been able to extend that passion for our mission into how we deliver technology for our caregivers to provide great health care. So I want to make just a few comments about this timeline and give you a little bit of our history of innovation. It really sets up the primary topic of what we want to talk about with imaging, sort of how we got here and why this is important to us. Our history of innovation goes back decades, as you can see here, but probably the thing that was most important in really launching our current state started about 15 years ago, back around 2004, when Mercy came together and really identified a critical vision that we were able to put into action. And that vision was, how do we bring all of our organization under a single electronic health record platform? And we really began the planning process at that time and aggressively then put a team in place to be able to do that. And starting around 2006, in partnership with Epic Systems, Mercy rolled out an electronic health record platform to its entire organization. And we didn't just do that alone with the vendor. I think one of the neat things that we did was that we employed over 300 of our own homegrown nurses, clinicians, technologists, folks from all the business operations and the IT operations, and even executive and physician roles were put on this team to actually do the Epic implementation. And that became one of the real key success factors of being able to do it fast and on time and under budget. And that really became sort of the mantra how we would deliver high innovative technology services in the future. And we didn't really stop with the implementation of Epic, but we really reinvested, or continued, I should say, continued to invest in the organization from that point, both in terms of our infrastructure. As you can see, we put quite a bit of investment into an infrastructure to open our own data center in Washington, Missouri, that houses all of our infrastructure, all of our equipment, all of the servers, all of the heavy technology that manages and drives all this, but also a reinvestment in our people, in our staff as well. A lot of times after these big Epic implementations, people go back to their original jobs, or in some organizations they're let go. But we not only retain those folks, but actually sort of reimagined how they can contribute to the organization in the future. And so the Epic team, along with the traditional IT organization, then were actually merged together to form now what is Mercy Technology Services, which I have been a part of. And Mercy Technology Services then forms the backbone of all of the technology services and provides not only the implementation and the support, but the ongoing optimizations and support for all of our clinical and technical users. On this slide here, it kind of looks on initial glance as a brag board of accomplishments, and it's really not meant to be that, but just to point out that we have received some recognition for a lot of this work and innovation that we've done. Just a couple I'll mention. We're very proud to have received the HIMSS Davies Award a few years ago for evidence-based EHR care pathways. And again, we did that not just to save money, but actually to make a difference in people's lives, where we actually saw reduction in mortality rates for heart failure and pneumonia patients. And then one other thing I'll mention on here is that we became Epic's first accredited organization, and we received recognition for that. And by that accreditation, that was in our ability to provide Epic services to non-Mercy entities. So that began our journey in commercialization, where we're actually extending our IT services and hosting services outside of our own organization. And I'll be talking a lot more about that here in just a little bit. So that brings us to the present. Or actually, let me still back up about 4 years ago, when we initially decided to turn our attention and take that same vision that we had for our EHR platform and now extend that to our imaging services. So what you're looking at here was our current state about 4.5 years ago. And I imagine this is something that many of you can probably relate to, either in your past or your present. At that particular time, we had 9 separate PACS systems. For the most part, they were outdated. And when you start thinking about what it takes to support 9 separate systems, it really becomes very not only labor intensive, but very resource intensive in terms of keeping everyone upgraded on various versions, replacement of equipment, extending storage capacity, and you can just go on and on. But when you're doing that for 9 separate systems, you're spending a lot of money and you're spending a lot of time keeping those things moving forward. And because of that, when you look at how that affected our users, primarily our radiologists, they were very frustrated. They were losing a lot of time with things like system availability. We had a lot of downtime issues just because old systems tend to break down, tend to cause a lot of issues in terms of where are the problems? Are they on the technical side? Are they on the software side? Is it the user issue? So a lot of troubleshooting, but that resulted in just a lot of frustration with our radiologists. We also did not have a lot of good functionality. So for instance, radiologists had to use multiple workstations to do their work, where a traditional PACS presented images to them. When they wanted to do the reconstructions, the 3D, the multiplanar reconstructions, breast imaging, more specialized imaging, they were usually looking at dedicated workstations. Sometimes those were the vendor provided workstations. Sometimes those were the other, just other niche vendors that provided them. But regardless, they were practicing what we call swivel chair radiology, moving around from workstation to workstation, multiple logins, a lot of time lost, a lot of time spent tracking down images, making sure they had all the relevant priors and relevant information that they needed to do their interpretations. And because we were doing the processing at the client devices, there was a lot of system slowness because as we began to go from, as we began to increase, for instance, the number of slices for MRs, CTs, and images like that, we were seeing just the data requirements were just so much more than they were in the past. So that was causing our systems to be quite a bit slower. When you look at how that affected the radiologist, we were starting to see a lot of burnout. And this happens to be a symptom that is not just within our organization, but this has been a key factor across the country as we've seen radiologist shortages, as we've seen a lot of other factors that are kind of causing radiologists to want to make changes in their lifestyle and in their work methods and in their workflows, just because they've been dealing with so many of these issues. And so we knew pretty quick that we needed some tools and we needed a change. So we really began that planning and that strategic process of how we were going to make changes. So what I want to show you here is how we really identified success factors in doing that. And I like to start with governance. I'm one of those that really believes that all good planning and results starts with great governance. And that's really required at a high leadership level, an executive level, as well as a clinical level. Now, right now, we're talking about PACS replacement. So the governance that we were talking about here was really focused around our radiology leaders, our radiologists, our IT specialists, and some other clinicians that were brought together to form really that governing body and selection group to look at our new, to look at a future solution. We used an external consultant. I'll just make a comment or two about that. The reason that we used an external consultant was not to help us with our planning or our strategy or really our decision making, but really to sort out what was going on in the industry from a vendor perspective. If you look back 4 years ago, that was really the time at what a lot of people call PACS 2.0 was getting off the ground. Where the industry was moving from the traditional vendor-centric PACS systems where one vendor sort of was looked to do everything, to now the best of breed solutions. A lot of people call this deconstructed PACS. There's a lot of different names for it, but essentially it's how do you identify the best of breed of each of the components that make up the imaging management system. And so we used a consultant just to help us really sort through who was doing what and what was right, what was wrong, what was true, what was false. And then we developed critical success factors. It was important that we met the needs of the radiologists, that they told us what was wrong and what was not going well. It was important that the latest tools addressed all of those things that were lacking, plus things that they needed to be successful for multimodality imaging in the future. The next point here, which is also something we'll talk a little bit more about here later, was understanding return on investment, and the only way that you can do that is by truly understanding what your costs are. And as many years as I've spent in imaging and hospital and healthcare operations, when we went through this process, it really caused me to look with wide eyes on how to understand total cost for imaging. It's really evolved from the days in which imaging costs were contained within an X-ray or radiology department, now to understand the infrastructure needs, to understand the networking needs, to understand the communication needs, and just all of the various components that go into that for support, for service, for the high skilled labor. So once you start really understanding that, then you can start realizing what return on investment should look like. And then, of course, we had to certainly test everything the vendor said with our own systems, with our own equipment compatibility, to make sure networks would work, to make sure that images would be available with the speed and with the functionality that they were talking about. So a lot of demonstrating and a lot of side-by-side type demos and things like that. And one other thing I'll just mention here before we move on is this having flexibility with the new solution to meet enterprise imaging strategy. Now, enterprise imaging is a topic onto itself here that we could talk about for a long time. I do want to mention it today because I feel it's very, very important that imaging departments certainly have an understanding what enterprise imaging is, and really to be able to make informed decisions about whether that's the direction an organization wants to go. That seems to be the trend if you look at what's going on across the country, and we'll talk a little bit more about exactly what enterprise imaging is and what are some of the components that make that up here shortly. So this is the solution that we came up with, and again, this was not just a few people locked in a room, but this was a very interactive process with our radiologists and our imaging professionals to not just look at these systems, but to really understand from a business perspective of how this would meet their needs and exceed their needs. And we really came up with a 3-vendor approach here. And I want to just kind of highlight this from a very high level. So we partnered with Visage Imaging for our enterprise viewer and vendor neutral archive. And for those of you that really know those components that make up PACS and enterprise imaging, you know that the enterprise viewer and the VNA are 2 of the real key components of that. It certainly was not a requirement to use Visage for the VNA. In fact, we actually had another VNA installed at the time, but felt that there were some operation improvements that we could actually see to really maximize their experience by utilizing the Visage one. So we made that decision. And from a viewer perspective, it was really important to understand just how revolutionary a universal viewer is versus just a workstation that does a lot of crunching of software just to get images to view, and we'll talk more about that. Second, we also partnered with Siemens Medicalis for the workflow orchestrator. I feel that this is a real important part to our solution. There's certainly a lot of different ways organizations can go to address workflow. A lot of times that can be addressed within the RIS, the Radiology Information System, or the actual electronic health record, but we felt that we needed a tool that could really orchestrate all of the components for imaging so that we could have a single source or a single place where radiologists could sit down and open up virtually every application that they would need to work, from their viewer to their reporting mechanism, to pulling up priors, reaching into the archive. Just about anything that could be associated with imaging was able to be orchestrated from a single location. And then finally, the third piece in that, but no less important, is the reporting and communication tool, and we turn to Nuance and the PowerScribe 360 solution for that. I imagine many of you are familiar with the Nuance products. I understand them to be prevalent in close to 80% of hospitals across the country, so that seems to be one that people are most familiar with, but that turned out to be a very powerful part of our solution to be able to help not just with the speech recognition and the reporting, but also the communications aspect of that as well. So let me go into just a couple details here. Again, I said this would not be highly technical, but I just wanted to mention a couple features here that really made this the right solution for us. With Visage, we really saw the advantages in their technology that utilizes what's called the server-side processing. So in traditional PACS, or certainly the PACS that we had prior to this, that most of the processing was done at the workstations. And if you've been in that world, or you're in that world now, you know that a lot of times image loading times or various parts of functionality can take quite a bit of time. What we're able to see here now is that once the images are provided through the DICOM sources, the heavy lifting and processing is done on the back-end servers and then streamed via rendering services to the client devices. One way of thinking about this is actually kind of like the Netflix of imaging. Pardon the simplistic analogy here, but it's like streaming in real time the images that are now available. So instead of waiting for all these to process at the workstation, they're literally available on the fly. And that's anything from a 2-view chest x-ray to a 1,000-slice CT with multiplanar reconstructions. And all that is available on the fly. And once you start looking at speed like that at a universal viewer, then you start thinking about how functionality, scalability, and things like that now can improve your operations. From a workflow perspective, again, this was an addition that made a huge difference in our organization. This enabled our radiologists now to be able to launch everything from a single workstation with a single sign-on. So whether that's specialty viewing for mammography or ultrasound or things like that, or any of the information that they needed to extract from the EMR, or any links or any reporting that they needed from Nuance, was all able to launch from a single location. And what's really great about this is that it is extremely flexible and customizable to an organization. And you can actually build those custom features or filters based on things like target service levels, subspecialty reading requirements. So in other words, if you have, for instance, very tight service expectations from places like the emergency department that need very rapid turnaround results, you can actually build that now into your workflow, and that enables those particular images to be sent to the right available radiologist in the right location at the right time. In terms of subspecialty, you can actually set this up to send images to radiologists that have particular subspecialty interests or capabilities that may not reside in all of your organizations. In other words, radiologists no longer have to be present within that particular organization to do some of those reads. And those are just some of the ideas around customizing workflows that we can have. And there's just so much more that we can talk about that, but those are just a few of the highlights. And then finally, on the reporting with Nuance, they provide for us the speech recognition through the Dragon Medical Speech Recognition engine. This is very, very customizable and configurable so that we're capturing data unlike we've ever been able to do before. And that data then can be used for so much in terms of analytics and even future AI capabilities. One of the things that's become very, very hot in this industry, and again, it's important to enterprise imaging strategies, is to be able to have interactive reporting capabilities, and that is now available, where reports can actually be linked with images, both past and prior type images, as well as things like lab results and other data that is captured in your organization. So there's just so much that is possible now through these reporting and communication systems. So let's talk about results, because I'm sure that's probably what you want to hear. Is so we made these investments, we implemented these systems, and we really figured that this was a huge boost, not just in our efficiency, but in our satisfaction for our users, and not just our radiologists, but our ordering clinicians as well, as they now were getting results faster than they had seen in the past. And again, we feel that this was a giant leap closer to enterprise imaging. Just a couple words about enterprise imaging. It goes beyond radiology, and then you start now envisioning what are all the capabilities of capturing imaging services under a single organizational umbrella. Enterprise imaging takes you beyond radiology and actually even beyond typical imaging services to look at things like light imaging or things like photographs or any images from the surgery and from surgery devices and cameras and things like that, to be able to get all of your images captured, managed, archived, and workflows developed so that they can all be managed under a single enterprise umbrella. And that's really what enterprise imaging gives you. So we felt that whether we were ready as an organization to step into that or not, at least now we had the infrastructure in place and we had the ability in place to build from there. So lower costs, that always is an interest to everyone. And this goes back to understanding what your costs are so that you can really identify opportunities to lower costs. Consolidating software alone was a huge cost savings for us. Being able to have everybody on the same platform, to be able to set up standardized workflows, to be able to really have clarity around what our total cost of ownership was, not just from an imaging software perspective, but from a hardware and a networking perspective as well, and a communication perspective. And so we're just now really getting our hands around how these costs have been lowered for us, and we even have more in the future that we're going to peel away. But this is a very exciting benefit that we're happy to talk about. Next is reliability, and it really goes without saying, going from 9 separate PACS systems managed in various data centers to a single PACS platform. Our reliability, our system availability, and just the reliability of the software and hardware has just been extraordinary. We have very, very little service disruption. Most of the times it's not even PACS software related. It's usually related to something on a network or something else in the infrastructure. But it's easy to pinpoint because, again, we have everybody on the same platform. We're at somewhere between 4 and 5 nines in terms of reliability, and from a industry standard perspective, that's very, very good performance. Speed, it just goes without saying. We're saying here study times are 4 times faster. There's some times where it was even much more than 4 times faster. When you think about a 1,000 slice CT being available literally within seconds, with reconstructions available on the fly versus having to wait 10 to 20 minutes for those to load, we added that up, and for our average radiologists, they were saving up to 2 hours now per person per workday, just launching images, present and prior images, just with those alone. So all studies from all modalities were now available at a single workstation rather than having to move around from workstation to workstation. So when you start thinking about how you can turn that additional speed into additional productivity and growing your business, higher satisfaction within your radiologists, you really start seeing that as a key benefit. Next, functionality. We've talked about this a little bit, but being at a single workstation with a single sign-on and having everything fully integrated at your fingertips versus having to move around and look for things really enabled some functionality that was just great for us. A couple things I'll mention here. Remote viewing was now possible, where we were able to actually set up these workstations for our radiologists in their homes. We've been actually able to hire some radiologists that don't even work in the states that we are in, so they can read for us remotely. This happens to become a big trend that you're seeing across the country as radiologists groups are finding themselves shorthanded and needing to find different solutions now. This technology is allowing us to kind of think about how we can address that in the future. And mobile imaging was another big thing here that we were able to pick up, where actually mobile devices now can be used not just for viewing, but actually for doing interpretations, even though we don't do final reads on mobile devices, but we do consultations and wet reads, and it's been huge satisfier for our radiologists on call that still like to attend family events and things like that. On a scalability, for scalability, we're talking now about what an enterprise platform can do to our organization. You start thinking about those other ologies now that can benefit from these technologies. For us, that's cardiology, ophthalmology, perhaps dermatology, endoscopy. There's so many other disciplines out there that utilize imaging type equipments now that can benefit from a universal viewer and the ability to archive, recall images, and design a workflow that's standardized for clinicians. So we're looking now to, in the future, to really begin to imagine what would an enterprise imaging organization look like, different from an organization that departmentalizes all of those imaging services. And satisfaction, you know, we have to talk about that. Sometimes people feel that that's a soft benefit. To us, that was a huge benefit just because our radiologists were so dissatisfied with their current situation. Being able to have system reliability, everything from an ease of use, the additional speed, and all of the advanced features available to them really resulted in tremendous satisfaction for them. One point that I missed on the cost savings that I'll mention here on the satisfaction slide before I move on was that, you know, we're still transitioning in our own organization from things like dedicated mammography workstations. We haven't done that completely yet. As you guys know, radiologists that specialize in mammography are very married to the solutions that sometimes they trained on or that they felt that worked best for them. We still have some GE solutions, some Hologic solutions in our organization, but about a third of our radiologists now have transitioned to the Visage platform for reading mammography. We have another major group that's evaluating it next month, and then, you know, we have others that are interested. So once you start eliminating things like dedicated mammography workstations and being able to use the universal platform, you can start thinking about how you can save a lot of dollars in not just purchasing those other systems, but keeping them upgraded and updated. So here's a quote here from our Vice President of Radiology Support Services, Mr. Bolin, who said, "Today we're between 30 and 50% more efficient, delivering study interpretations that much faster to care teams." We actually have a more exact number on that right now. In fact, our turnaround times that we have been tracking is currently running at a 41% improvement. And those of you who are in the business know that that's a huge impact. Now, turnaround time can have some subjective elements to it because obviously the ordering physicians have to be available to look at those images. But the point is that they are available to them 41% faster now and more efficiently than they were in the past. And that makes a huge difference in decision making and patient care. So what's next for us? Well, we're on a journey. We have not arrived. We're not there yet. We're not doing victory laps yet. We're on a journey like many of you are. So what we want to do is be able to take these investments, capitalize on the potential, and move forward. Some of the things that we're talking about are, for instance, eliminating third-party reading services. Again, because of the radiology shortages and the desire to not necessarily read 24/7, our radiologists, like probably many of yours, have looked to Nighthawk type services or third-party services to do some of that work. And we're looking now at how we can take our gains and efficiencies in these technologies and look at ways of eliminating or certainly reducing the cost of doing that. We're also looking at how we can aggressively implement artificial intelligence. I hope if you're staying up with what's going on in the industry with AI, that you've been able to attend some of the great webinars and other sessions or read some of the white papers on what's available in AI and imaging out there. It's absolutely huge, and I think it's going to continue to be a game changer for radiologists and for clinicians and for how people look at data in their organization. We're starting to look at some of the things that will make sense for us for AI. And we're going to probably start at a very high level, but we intend to get very aggressive as we get more data and as we have the confidence that that data can be used to really continue to improve healthcare. We're looking at deploying to other service lines. We certainly have cardiology within our scope, and we're starting to look at some of those other ologies that could benefit from this. I imagine, and same as many of your organizations, that you don't have every subspecialist present on site in each organization. So we want the ability to send images for any subspecialty reading requirement to any available radiologist in our network. And so to do that, we can certainly design workflows to do that. And we plan to do that here over the next few months. And so that really brings us now to a little bit of a different discussion about future-centered governance. So I talked earlier about the radiology centered governance just to get our solution off the ground. I believe the governance for the future really needs to be heavily involved with several of those other imaging disciplines and key executive leadership, both clinical and executive, within your organizations. Just about everybody that I've heard from or that I've listened to on webinars like this, or I've read white papers from that have been successful in enterprise imaging, have very robust, aggressive, and successful governances in place where decision-making can be made on purchases, on capital expenditures, on how storage is going to be done, viewing devices that are going to be deployed, and things like that for the other ologies. Again, that's a big discussion that we can have offline, but that governance model is going to be essential for future operational plans that need to be more centralized rather than departmentalized. So that brings us here as we kind of wind this down to ask the question, how are you going to overcome some of the obstacles that you might be experiencing? If you have an aging PAC system, that you have a lot of heavy, expensive maintenance, you might be dragged down by complex workflows with little or no standardization, with growing demands for speed, scalability, functionality, just making it hard to grow and hard to stay up, with strained financial resources and competition for capital dollars, and the ability to deliver on a true enterprise imaging strategy and return on investment. So those are obviously things that we continue to look at, and I'm sure many of you are looking at that as well. So here's a quote from our Chief Information Officer. As healthcare provider, we know how critical it is to use technology resources wisely. And I think that's one of the things that makes Mercy Health System very unique in this space, in that we are users, we are providers, we are clinicians, but now also we have the ability to be as a vendor and to actually host these services for others. So we help people understand things like, what is your total cost of ownership? I mentioned this earlier. Here's a little bit more details around some of those things that you need to consider if you're trying to look at your cost of ownership. It's more than software, where you have viewers, dictation, transcription devices, the information systems, and some of the AI algorithms that go into it. But you also have all of your hardware, your servers, your storage, your archive, your workstations, the infrastructure and networking, which was huge to us. As we began to sample our future solutions, we realized that we had some real problems, not with software and hardware, but with our networking and our ability with limited bandwidth to push images across states, or even from state to state, or to our data center. Cost of ownership involves maintenance, and you really have to look at that critically, at what it takes to keep all of those components up and running and up to date. Data being managed now by several organizations, and it's important to really realize who owns the data and how that data can be used, not just for archiving and migration, but for decision making in the future. And then IT, labor, and support. And that's really one of the big costs that sometimes gets overlooked, because it's beyond just the technologists and the radiologists in the department, but it's all of the infrastructure, labor, and the support that goes into that. And when you really start to think about that, then you can begin to clearly define what a solution would look like to help address that total cost of ownership. So as we wind down here, I want to talk a little bit about one of the things that Mercy has done to address this for others. About 5 years ago, we began our commercial health IT solutions division. And this is where literally we can bring hosting and healthcare services to other organizations outside of Mercy. And you see a sampling here on this slide of some of the services that we have already done. I mentioned Epic earlier. Epic as a service has been out there. We've been doing that for almost 5 years now and have that in several organizations coast to coast, where we do the implementation and the support and the optimization for them. There's other things for such as cloud work and some of the hosting services that we've been doing. And most recently now we have launched PACS as a service, kind of in the same light as we do Epic. We now offer this as a service, as a hosted or a cloud-based solution for those that might be looking for help with a future PACS solution. We talk about ways to reduce IT cost and complexity, and we basically say you can streamline it by leaving it to others that have gone that way before you. Providing software as a service now is becoming a standard across the country. Many are looking to cloud-based services rather than doing their own hosting. And this has just made it much simpler. It's a single stop, if you will, for finding solutions for some of the more technical components. It consolidates a lot of the systems, and really you're able to capitalize on the IT and clinical expertise of others that have done this, and it's really a partnership. It helps to be able to forego a lot of the capital expense, especially where we can develop sort of pay-as-you-go type models for paying per study rather than all of those capital expenditures up front. And you're using them on a per study basis for what you use. So there's just a lot of ways to streamline this, and this is what we're excited about talking to others about providing. We say gain all the benefits and remove all of the burden. Well, that's not 100% true, but it's largely true here, being able to gain reliability, performance, scalability, eliminating capital expenses, paying for what you use, having your storage and security needs. We haven't talked a lot about security, but that is a huge process that every organization not only needs to understand, they need to be 100% accurate at it. And so that's where the benefit of working with somebody who has done the security requirements for healthcare, has met and exceeded those requirements. We know that that's a daunting challenge, and that's something that we're very, very good at. And we're helping radiologists manage demand and burnout and boost their satisfaction as well. So we're very, very excited if we could have the opportunity to talk to anybody about gaining these benefits and removing some of those heavy lifting burdens. We're happy to do that. Feel free to reach out to us. You see my email here, or if you know anybody else within Mercy that you can reach out to, we would be very excited to speak with you. And Lori, with that, I think there's a few minutes left. I'll be happy to turn it over to you for any questions.
Thank you, Jim. As he said, now we'd like to open it up to the audience for questions. Please use the questions panel to submit your questions. The first question, Jim, can you tell us a little bit more about how Mercy's radiologist groups are structured?
Yes. So I mentioned there were previously 9 PACS systems. Well, at some point, there's been at least 9 separate radiology groups servicing Mercy. There may be less than that now. There could be some that are working more together, but the point is there's multiple radiology groups that still provide services. Most of them, I would say at least 2/3 of them are independent groups, and about 1/3 of them are employed or integrated, as we say. I'm only stating that because you can be very successful at things like standardization, decision making, and bringing everybody together to sort of have a common vision, regardless of your corporate structure with your radiologists. And so I don't really have anything more to say about that. I'm not promoting one over the other. I'm just saying that whether your radiologists are employed or contracted, you can still get them to work very well together, as ours have done. I will say we still have some images that are sent off-site to a Nighthawk type services for third shift, but we hope to reduce or eliminate that in the near future.
Along with some of the other pain points Mercy had, do they have a need for image exchange with outside organizations and healthcare providers in the community? And are you addressing that need?
Yeah, that's a good question. Image sharing is unlike enterprise imaging. It's another one of those topics that we could spend another dedicated webinar talking about. In fact, I've attended a few on that topic. It's big out there, just as we are becoming much more integrated with electronic health records and being able to share information from organization to organization. Which has been a huge benefit to us as patients, being able to track our health records as we go. I've moved from one state to another and still have access through a single portal to all of my information. Well, that same type of thinking is now being applied to imaging. And so, image sharing in the old days was done by wrapping up films and sending them in big envelopes and hoping they didn't get lost. That progressed into CDs that a lot of times were hard to track, hard to find, didn't load on all the devices in an organization, and was a single source. So the best answer is really, how do you do that in a more integrated way? And there is some image sharing software solutions that are out there. We happen to utilize Nuance's PowerShare. That's required at both ends, so the sender and the receiver. So there are a lot of other software solutions as well and things that people are doing, but image sharing is important. It's as important as sharing images as it is the rest of the electronic health record.
Thanks. Can you talk a little bit about the cultural and organizational challenges you see with instituting a true enterprise strategy, and what's your vision for tackling those challenges?
Wow, that's an easy question. Thanks. That's a great question, and I think that's a question that not only we're facing, I think the industry's facing it as well. It just makes sense to think about how you can expand these capabilities that we've talked about today to everybody that could possibly benefit from them. But to be able to do that, you've got to get a lot of people on the same page, and you have to have a mechanism in place for the planning, the executing, and the decision making. And that is done, that you have to begin with good governance. And virtually every one of these types of presentations that I've attended or white papers that I've read for folks that have been successful at EI have all started with and preached out of both sides of their mouth. I mean, they really preached heavily the need for strong governance here, where you really have to break down traditional lines, where the radiologist can't make all the decisions, where the cardiologist can't make all of the decisions, but they all can make some of the decisions or certainly be a part of integrated decision making. Where instead of ophthalmologists feeling like they have to compete for capital dollars for their own viewers, they might now be able to look at a universal viewer that's already in place and has the ability not only to present their images, but to store and archive their images as well. And so to do that, you have to break down a lot of traditional walls and barriers. And so just getting people to realize the capabilities and start talking about that, informing governance for decision making, and really deciding what's our vision. How far do we want to take this? Do we want to have a true enterprise imaging strategy in place, or do we just want a better radiology department? And those are the things that people have to look at. And that's really where we at Mercy are now. We're taking this beyond radiology now and starting to challenge some of these other ologies on how they can be a part of this.
All right, that was our last question, so it will conclude the webinar. I want to thank everyone for joining us today, and thank you, Jim, for a terrific presentation. We look forward to seeing you at our next HIS Talk webinar. Enjoy the rest of your day.